Hello, everyone. Thank you so much for joining us today for the Community Connect webinar series, episode 4, Imaging for All. Today's speaker will be Deniz. Deniz did her PhD in cell biology at the University of Freiburg. She did her postdoc specializing in B lymphocyte biology, also at the University of Freiburg in Germany. Deniz has extensively used advanced imaging technologies and image analysis methods in her scientific work. During her postdoctoral work, she facilitated collaborations with imaging facilities to apply various imaging modalities to her research questions. In March 2024, she started her new position at the Global BioImaging at EMBL in Heidelberg, and currently she runs the Imaging for All funding program, where she's preparing the Imaging for All open call to provide global bioimaging facility and training access to low and middle income country residents. And so without further ado, Deniz.
Hi, thanks Precious for the introduction. I am going to, you can hear me, all right?
Yeah.
Thank you again for the nice introduction. It is a pleasure to be here presenting at the newly started ABIC Community Connect webinar series. I really hope that my talk is going to be relevant for the audience here today. Today, I'm going to talk about a new funding opportunity in bioimaging called Imaging for All. I am Deniz Saltukoglu. I'm the scientific project manager of this funding program, and I am working at Global BioImaging, situated at EMBL in Heidelberg, Germany. Before I delve into the subject of Imaging for All, I will make a brief introduction of Global BioImaging. Global BioImaging is an international network of cutting-edge bioimaging facilities and communities, of which African Bioimaging Consortium is a part of. Global BioImaging brings together the expertise of these various imaging networks to learn from one another, and it organizes certain activities for that. So training courses and online training platform is one. We also have an international job shadowing program that connects imaging scientists in imaging facilities under GBI. And we have an annual conference, which is the exchange of experience, which again connects our partner networks and communities around the world. And we also have working groups for forming international consensus on the subject of bioimaging. In today's talk, I'm going to start explaining what is Imaging for All. I'm going to give some background for it. Then I'm going to explain the 3 funding tracks that we have called the Access Pro and the Training tracks, how you can apply to this funding, how we will evaluate your application, and also the timelines for the application process. What is Imaging for All? Imaging for All is, first of all, I4A in short. It is a cascading grant that was given to Global BioImaging by the Wellcome Trust. Cascading, what it means, cascading grant, this is a bulk grant from Wellcome Trust to Global BioImaging of over 1 million euros, which Global BioImaging will redistribute smaller portions to sub-recipients. And this will be for funding of free access to imaging instruments, and it will be also for free participation in training courses. Our target group here are researchers and imaging core facility professionals that are affiliated with institutions only in low and middle income countries. When I go into the eligibility for applicants a little bit more, we will fund researchers of all levels, undergraduate students only in some cases in the training, so in the training track probably, but in the other tracks we will fund master's students, PhDs, postdoctoral researchers, principal investigators, laboratory technicians, and staff scientists. And on the side of the imaging facility professionals, you could be an imaging facility head, manager, or staff, imaging facility staff. You are eligible to apply to these funds. as said, you have to be affiliated with a not-for-profit organization like a university or a research institute in a low and middle-income country. We will have no restrictions on nationality, and eligibility will be determined by institutional affiliation only. Wellcome Trust puts one exception for applicants and also hosting institutions. They should not be recipients of any tobacco industry grants. Yes, and eligibility on the hosting institution side is, this time it is not restricted to only low and middle income countries. It could also be a high income country. You could visit a high income country with this grant. And the applicants can opt for national access, except they cannot use these funds to work, to access imaging facilities or training courses in their own institutions only, or they could opt for international access. So they could travel to another country, another region, another continent, and use these funds. Shortly, what is the background for I4A? Wellcome Trust had commissioned a report to Technopolis Group a couple of years ago, and they asked the questions, what are the key emerging bioimaging technologies and methodologies in the world at the time, and what are the main barriers to progress and adoption of these bioimaging technologies? And when they asked this question, it was in the form of a survey. When they asked this question, they distinguished between researchers, the answers from researchers in high-income countries and low and middle-income countries. And the answers were for low and middle-income country researchers was more than high-income countries. They stated the high cost and lack of availability of bioimaging equipment and bioimaging infrastructure in doing bioimaging experiments. And also the technical expertise therefore was lacking, and also the software, imaging software and consumables were also considered high cost. And there was also a reluctance to share equipment or data among researchers. And also importantly, core bioimaging facilities are key to progress in bioimaging, and in LMICs, there was a lack of career path in core bioimaging facilities, and also training opportunities and awareness in this area. Therefore, as imaging is now such an important tool in biological and biomedical research, Wellcome Trust came up with the idea of a cascading grant and a funding program for imaging instrument access, knowledge exchange, and imaging-related training for low and middle-income country researchers. Global BioImaging, we created the content of this funding program and the tracks that would correspond with the needs of LMIC researchers in accessing imaging equipment, training, and knowledge exchange. So we have the access track, the pro track, and the training track. In the access track, our target group is researchers of all levels. The aim is to access imaging instruments, and this is worldwide. So the hosting institutions could be worldwide. And we would support the applicants, the awardee, going from their host institution to an institution for imaging instrument, for another institution for imaging instrument access. And the budget is up to 10,000 euros. And we are imagining a 1 to 2 week visit at the hosting imaging facility. The pro track is a little bit different in that the target group is more imaging facility professionals. It could also be, in some cases, experienced microscope users. And for imaging facility professionals, this is more of a job shadowing experience, in short, to learn about a specific role in an imaging facility, or to learn about management of a part of this hosting imaging facility. And experienced microscopy users can use this track also to access imaging instruments for an extended period of time. So here we are imagining a budget up to 20,000 euros. And you don't have to spend this whole amount. Of course, you could stay for a week, but you could stay up to 4 weeks in the hosting institution. Here, the imaging facilities are limited in selection. So we will have, I will explain more in detail in the upcoming slides. Selected GBI partner network imaging facilities will be eligible as hosting institutions here. And in the training track, this is open to researchers of all levels and imaging facility professionals. And here you can basically participate in a training course. And we have a budget here per person up to 5,000 euros. What are the costs that are covered by this grant? Imaging facility access fees will be covered. This will include instrument access, consumables. If you use additional services at the imaging facility like cell culture, animal handling, it could be image data analysis. This would also be covered by the grant. We would, of course, cover also in the training track, training course, workshop fees, travel to the destination, local travel, and also travel insurance is covered. Your accommodation, also your daily allowance in the form of meals, and visa processing fees. These are all costs covered by the grant. So we will pre-book, we will try to, whenever we can, we will try to pre-book tickets and hotels. If not, we are going to reimburse you. We have an administrator for this, Susan, who is also in the audience today, who is going to work with you to book your tickets and accommodation as an awardee. And we will also provide guidelines for booking, so any kind of booking with the acceptance letter. Okay, so a little bit more detail about the access track. This is free access to biological or biomedical imaging technologies and related services. So if you have an experiment, if you would like to explore your scientific question using an imaging technique that is not available to you, or you would like to image your biological sample with another imaging technique in order to increase resolution, in order to, let's say, have a time course images. So any upgrade to what you have, you could think about applying for the access track. You could also use this opportunity to learn a new sample preparation technique, and of course a new imaging technique. You could ask for expert advice for developing a new imaging assay. And of course, for many other aims, it could be used. As said, the duration is 1 to 2 weeks. We expect here an imaging expertise from low to high. We ask the applicants to choose their hosting imaging facility themselves and apply for these funds together. Of course, we are here to help. We are going to provide application support throughout the open call. So you can consult us for any kind of support and advice in also finding an imaging facility. In the pro track is more for imaging facility professionals and for them to exchange knowledge, best practices, and management know-how. So if you are an imaging facility professional and who would like to receive an in-depth specialized knowledge in an imaging modality or another sample preparation, this track is the right track for you. Here you could also do job shadowing, learn imaging facility organization and management from others. You could also learn image data analysis, expand on image data analysis, storage and management know-how. This track is also particularly useful for imaging facility professionals who train other researchers or imaging facility staff. And as said, if you're an experienced microscopy user, you could also use this for doing experimental work for an extended duration. Here we expect the imaging expertise to be high, and we have only selected imaging facilities as hosts here. We do expect that the applicants consult us for hosting imaging facility match. And who are eligible for this as hosting facilities? These are GBI partner network facilities that are independently evaluated for their open access services. And for instance, Africa Microscopy Initiative, AMI Imaging Center at the University of Cape Town is eligible as a host. Eurobioimaging facilities or Microscopy Australia, National Imaging Facility Australia, ABIS in Japan, and Singascope in Singapore. And we also have some additional facilities from our GBI International Job Shadowing Program that are eligible. So Central Analytical Facilities Microscopy Unit at Stellenbosch University, or some other facilities in USA, Canada, and India would be eligible for this track. So how would one apply? There's a couple of bunch of steps to this. First, we ask you to submit your inquiries to us, to the I4A team. You can send us an email and talk about your project, your goals. And for the access track, this is optional, but this is highly recommended. And for the pro track, this is a requirement. We have to talk beforehand together to decide what would be a suitable hosting imaging facility. I really recommend for the access track to get in touch. I believe that applicants would have higher chances of being successful if they consult with us while preparing their applications. This would avoid mistakes, and the applicants would not start off on the wrong foot with their applications. Then comes contacting. So once the facility is decided, then you would contact the prospective hosting facility. And here you would discuss your project requirements with them, you plan your experiments, and they assess the technical feasibility of your project. We have some forms here to help the applicants, a project description form for the access track and the visit plan form for the pro track. So here the project description form has to be filled out by the applicant and the hosting imaging facility together. Here what we want from the applicants is they write about the scientific background, objectives, and expected outcomes of their project. We would need an experimental plan, which imaging modality they would like to use, and also very importantly here elaborate on pre-visit preparations like sample and reagent shipment. So if you are going internationally, then it is very important that these things are thought about early on. Can you actually ship your samples to the destination? Is that at all possible? How does it work? So all of this needs to be kind of pre-pondered. Once this project description form is ready, then the hosting imaging facility will give us their confirmation of support. They will evaluate if the project is technically feasible. They will confirm that the project can be performed at their facility, and we would also ask for a price estimation at this point. For the pro track, we have the visit plan form instead. Again, this will be jointly filled by the applicant and the hosting imaging facility. They will outline their plans. So applicants will here outline their plans and objectives for the facility visit. This would be who will be your instructor, what dates you are going there, you plan to go there, technological aspects and theoretical aspects of the visit. We would like to know. Also, pre-visit preparations is important here. And if you are planning experimental work, you would need to fill out a project description form. Once again, here also in this track, we will need the confirmation of support from the hosting imaging facility. So once these important steps are done, accomplished, then you can submit your official application to I4A. And here we ask for, in the application form, if you are applying for the access track, the justification of the imaging facility location. So this could be about location, logistics. Do they have the equipment that you need? And for both Access and Pro, we ask for scientific interests of the applicant, whether the project plans align with their research or career interests, what is their motivation, short-term and long-term goals, what is the impact of the visit to their careers, and also knowledge dissemination. What do they plan for after this grant? And examples could be user training here, student supervision. So it could be plans to host workshops, give courses, and giving talks. And we also would like to have a short CV with the application. Then we will assess the applications by scientific review. We will use a point-based evaluation system, and we will look at certain criteria, like it's written out here. And then for the final selection criteria, we will try to make sure that the grants are distributed across home countries. We will also care that there's going to be a balance in gender representation. And if necessary, we will distribute the grant according to project topics. So we will try to have an equitable distribution across project topics. Then what the applicant needs to, the awardee needs to do is to formalize their visit. They would have to apply for, if necessary, visas, and they will start thinking about sample shipments. And finally, very briefly, the third track that we have is the training track here. This is to participate in in-person training courses and workshops. This could be practical courses on microscopy techniques. It could be image analysis courses. And again, so courses that are related to running and working in an imaging facility. The imaging expertise here would be, we require something from low to high. Yeah, here you will apply for a training course and you will submit your application to I4A. We will assess, and we will assess here. The first step would be, we will evaluate, of course, assess the training course workshop that you have applied for, check whether this is a predatory course, whether the program is rigorous enough. And then, so we will again have a point-based evaluation system, whether the course is relevant to your scientific aims, motivation, impact on scientific career, and what are your dissemination plans. So the call is, we are preparing the first open call. We will hopefully begin the open call in August. It could be somewhere in August, mid-August, maybe, hopefully the beginning of August. So we will we will have application support, and the application phase will begin. It will run for 3 months. At the end of the 3 months, we will have the revision phase, and we will announce the awards. And from that point on, awardees can start with their travel arrangements for their visits. And so since this call is not yet open, I advise anybody interested to follow the GBI Partner Network newsletters. The call will be announced there. And also social media accounts of GBI partner networks. And once the call is open, you can visit our website, globalbioimaging.org, and there you will see a banner like this one. You can click on and learn more about it and also apply for the program. Well, I'm really hoping that we have in the audience already people who are interested in applying for these funds. And I really thank you for your attention. And yeah, happy to take your questions.
Thank you so much, Denise. That was very informative and very exciting. I'm sure we'll all be making sure that we pass this on to those who we know will benefit greatly from this.
Yes,
The one
also.
question, sorry, yeah.
No, also, yes, passing the information on is also very important.
Certainly. The one question I do have for you is where can we go about finding the list of low to middle income countries?
Yeah, this is a list, low and middle income countries. This is determined by OECD, and you can find this on the Wellcome Trust webpage. And also, if you type in low and middle income in Google, so you will income countries, you will see a list. But best to take the one on the Wellcome Trust website.
Thank you. I see Georgina has a question. Georgina, are you able to unmute?
Yes, I think I've unmuted. I can't do my video, but that's fine. I don't mind that at all. Thank you. Thank you for the talk, Denise. I'm just wondering if you're going to run it more than once. Is it going to be a multi-year call or is it a one-off?
Yeah, sure. Very good question. It will be multi call. So it will run for this program will run for 3 years, and in the duration of the 3 years, so we plan maybe 3-4 calls in 3 years, even more. We will see how it goes.
Fantastic. Thank you. So that you can plan a little bit now, knowing that these will come up. Yeah.
Yes, for sure.
Thank you for your question, Georgina. One question that we do have here as well, is there a specific reason that you know of, Denise, why countries that are funded by tobacco grants, countries that get tobacco grants are excluded from this?
This is not my rule. This is from the Wellcome Trust. So I cannot really comment on that, but it's a rule from the funder.
Fair enough. I don't know if we have any other questions from the audience. Please feel free to post them in the chat or raise your hand and we'll let you unmute. While we wait for that, Denise, I know that you have essentially this rubric that allows you to determine whether an application is a good one. Is any of the criteria, for instance, your research question or your experiment, does it weigh more than any of the other elements of the criteria, or do they all weigh the same?
Yeah, so on this list, yes, for example, I can here all the criteria weigh the same actually. So each item is going to be scored from 0 to 4 points, and this evaluation system is also going to be up on the website, so applicants will be able to see how they're evaluated.
Wonderful. I see we've got a comment from Akwaba. We just got these microscopes installed in our research center, but do not have the capacity to operate them. The microscopes are one, the Carl Zeiss model, Leica ink, the Nikon ink model, number 4 is the Nikon ink model. I'll be happy to take part in this program to put these microscopes into use. I'm not sure if Akwaba is offering to have his facility be one of the...
I don't think it will be possible for someone to come to them, but it's definitely possible somebody from their group going to an imaging facility, visiting an imaging facility under the pro track, and learning about the microscopes. And we can really also help with a destination where they can go and and learn about operation or what they need to learn about. But this program is not going to support somebody, a professional traveling to them.
Yeah. Okay. So what I'm understanding is that Akwaba could themselves apply to be the person that gets taught how to best operate these instruments, and then come back and distribute that information to the people in his facility. Okay. They are requesting that they share contact, Denise. Is that something that you'll be able to do at this stage, or once the call opens, there'll be a dedicated email that people can contact?
I didn't get the very first part of the question, but I understand if there will be a dedicated email address to contact us. Yes, there will be, and this will be published on the website. Yes,
Perfect.
definitely. Mhm.
Okay, thank you so much. I don't think there's any more questions. This was a wonderful presentation, Denise. I really appreciate it. Oh, here's one more.
Mhm.
Akwaba says he's from a vaccine research center in Nigeria. He wouldn't mind traveling to learn how to use them. That's wonderful.
Great. Mhm. Yes, we are waiting for their applications once the call opens.
Please do apply, Akwaba, and make sure that you take advantage of this opportunity. If there aren't any more comments or questions, Denise, thank you so much for this wonderful presentation. It's very helpful. I thank you for spearheading this initiative. It's really important to make sure that we increase access to microscopy across the continent and across all these low and middle income countries. So we really appreciate all the effort from yourselves who are coordinating it and from the funders as well. And so, yeah.
Yeah, I really hope it will be useful for all.
Definitely, certainly. And also even it being across the different levels of study. I think a lot of the time students get excluded a bit. And so knowing that they have an opportunity as well, and even people with low knowledge on imaging and microscopy, knowing that they can come into this and even learn how to prepare samples in some instances, I think that really opens the pool up for a lot of people.
That's
So
right.
it's very much appreciated. And so, yes, thank you so much, Denise. Have
Thank
a
you.
wonderful day, everyone. Thank you all for attending, and we'll see you on the next episode.